Good afternoon, everyone. I'm Emily Haynes, Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you for joining us today to kick off this year's Power to Protect New Jersey flu campaign. We are thrilled to have joined together over 100 organizations from all over New Jersey that have committed to promoting flu vaccination this season. I would like to thank the New Jersey Department of Health Vaccine Preventable Disease Program for supporting this campaign and collaborating with us on the campaign materials and resources, which have been updated this year and which we will be sharing with you today. Vaccination is on the top of mind of every New Jersey resident. However, with the return to in-person learning at many schools and some workplaces returning from remote work, we can anticipate that this influenza season may bring some unique challenges in promoting flu vaccination in addition to COVID-19 vaccine. Families are busy trying their best to get back to some sense of normalcy as we continue to battle COVID-19 and the highly contagious Delta variant. While we continue to promote COVID-19 vaccination for those eligible, we cannot let our guard down against another dangerous respiratory virus, influenza. Influenza vaccination continues to offer the best protection from flu for those 6 months and older. This campaign has a wide reach thanks to the efforts of the New Jersey Influenza Action Group members. Thank you for your tireless dedication to protecting the public health of New Jersey residents. Now I'd like to introduce Amy Gohl, the nurse consultant coordinating this campaign, to share more about the status of the Influenza Action Group and some campaign updates. Amy has been reaching out to all of you over the past month, ensuring that the Action Group membership is representative of various groups throughout the state. Amy?
Thanks, Emily, and good afternoon. We're thrilled to have so many champions with us on today's kickoff. I'd like to share some background information about the Power to Protect New Jersey campaign before we hear from our keynote speaker and showcase this year's initiative. Our most recent data on influenza immunization in New Jersey is from the 2019-2020 flu season, which is the season before the Power to Protect New Jersey campaign began. This chart shows flu immunization by age. In total, only 54% of New Jersey residents over the age of 6 months received the flu vaccine. While this is somewhat better than the national rate of 51.8%, it is a far cry from the Healthy People 2030 goal of 70%. If we take out the children and only consider New Jersey residents over the age of 18, less than half, 45.2%, received a flu shot. Burlington County had the highest adult immunization rate at 51%, while Warren County had the lowest, 31.6%. With New Jersey's adult immunization rates being lower than the national average for adults, which was 48.4%, the New Jersey Department of Health recognized the need to place more emphasis on the importance of influenza vaccination. So for the 2020-2021 flu season, the New Jersey Department of Health collaborated with the Partnership for Maternal and Child Health of Northern New Jersey to create and launch the Power to Protect New Jersey campaign. The goal of the initiative was to promote flu vaccine for New Jersey residents 6 months of age and older by emphasizing that we all have a personal responsibility to get vaccinated in order to protect ourselves, our loved ones, and the community in general. In other words, we each have the power to protect. The campaign had a three-pronged approach. The first was to create a website, powertoprotectnj.org, to supply flu and flu vaccine information, access to educational messaging and materials, and a listing of flu vaccination events throughout New Jersey. The website was designed to be user-friendly and viewable in any of 21 different languages. Second was to devise a marketing campaign, which included advertising, graphics, social media messaging, video interviews, hashtags, and more. Shareables with simple messaging and ready-to-use graphics were created for Twitter, Instagram, Facebook, and made available in Arabic, Chinese, Haitian Creole, English, and Spanish. And finally, how best to spread the information throughout the state? Through community partners, of course. Outreach was made to community groups, hospitals, organizations, practices, and schools to form a New Jersey Influenza Action Group. So how do we do? Well, the Influenza Action Group grew to over 140 members, representing all parts of the state. The marketing campaign and website had 26.2 million total digital media impressions. Pretty impressive start, but we know we still have a lot of work to do. Of particular concern are the variances in immunization rates among residents of our state. The variances are dependent on insurance coverage, level of education, and as demonstrated in this bar graph, on race, ethnicity. Reading from left to right, the green box is for Black non-Hispanic residents at 44.5%. The gray box is for Hispanic individuals at 49.4%. The teal box stands for other or multiple races non-Hispanic, and that's at 57.6%. And all the way to the right, the pink box is white non-Hispanic at 58.6%. As public health professionals, we are faced with the question of how to address and reduce these disparities. With us this afternoon is Carlos Velazquez, who has over 25 years of experience in health communications. He has overseen large national social marketing campaigns targeting hard-to-reach populations that address diverse health issues, including tobacco control, HIV/AIDS, infant mortality, and immunization uptake. As the president and CEO of HMA Associates, a communications firm based in Washington, D.C., Carlos supports the mission of the agency, which is to eliminate health disparities and achieve health equity. He is an award-winning author and speaker who has given workshops and keynotes at conferences all over the world. His work to promote COVID-19 vaccination among underserved populations will be featured in a book that will be published next month that highlights the global response to the pandemic. Before I turn the meeting over to Carlos, I want to encourage all of the attendees to write any questions you may have for our speaker in the Q&A box, and he will answer as many as possible at the conclusion of the presentation. And now it's my honor to welcome Carlos to our kickoff call.
Thank you, Amy. It's great to have that very generous introduction. And I couldn't have written it better myself, and perhaps I did write it myself. It's a pleasure seeing all of you here today. And even if it's virtual, it still makes a difference in terms of seeing the kind of commitment that you have in your state to make a huge difference in relation to the flu disparities that exist. And thank you again, Emily, for reaching out and saying hello and making this particular session possible for me. I had the pleasure of meeting Emily about 3 years ago, and I literally just went to the train station, got on the campus, did my session, got back to the station, and came back to Washington, D.C. It was a quick trip, but one that was well worth it because I saw some old allies and friends from New Jersey. We did some work with the CDC, and so I had the chance to develop some partnership work within the state of New Jersey. So some of you are very familiar, and your organizations are very familiar to me. In relation to what I'm going to cover, I'm going to identify some vaccination coverage disparities. We're going to talk about some stories and the power of stories as a way of you being able to get information, messages out about disparities. And then we're going to talk about some tools and materials that all of you can use as a way of being able to promote vaccination. According to the CDC, among adults 18 years and older, the overall coverage estimate was about 48% during the 1920 flu season. And as you can see from this slide, the flu vaccination coverage was very different for each particular population group. In this case, among Latinos, about 38%, among non-Hispanic Black people, 41%, among American Indian or Alaska Native people, 42%, among Asian, 52%, and in relation to the white population, about 53%. This particular chart shows, again, the disparities that exist in relation to hospitalization rates. As you can see, Hispanic Blacks about 68, compared to whites at 38.1%. The disparities are real, they exist, and it's something that I'm sure that all of you are quite familiar with and are trying to make a difference. Among children, disparities in severe flu outcomes were greatest in the youngest age groups, 0 to 17, with hospitalizations, ICU, and in-hospital mortality rates were about 1 to 4 times higher among racial and ethnic minorities, aged 0 to 4 years, compared with non-Hispanic white children. And you can see from these bullet points what those numbers were, ranging from among non-Hispanic Black children, from 2 to 3 times higher, to Latino or Hispanic children, 1 to 3 times higher. The disparities exist. So let's move from a conversation about disparities about what you can all do to make a difference. And one particular strategy that could make a difference is the power to tell your stories. And we're going to examine why stories work as a way of being able to shift narratives about flu vaccination. We know that data is insufficient. Yes, it provides a rational argument about the need to address the issue around disparities, but it is not always sufficient. What we need to think about, and I heard Amy talk about this, is the power of being able to get the messages into trusted messengers. You have partners that you have been able to cultivate within the state, and I applaud you for that. But it's really important to actually activate the partners and get them involved, engaged, to be able to create an echo effect of your messages. And what's really important also is to have stories that appeal to emotions, because people are more likely to pay attention to stories that have an emotional appeal. And this can also motivate people to change their behavior. In this case, the desired behavior is getting an annual flu vaccination. If we look at this from a cultural perspective, we know that oral history has a long, long honored place in many cultures. It's a way of being able to share values and beliefs. The tradition of storytelling is something that's very much valuable and used within African American, Latino American Indian cultures, Asian cultures. And for the most part, we have a lot of evidence that says that stories shape our understanding of the world. Think about how perhaps you learned how to read, learned how to ride a bike, learned how to dance, learned how to do a lot of things. People shared, demonstrated, was also the power of stories. We can actually put ourselves in the shoes of the other. We have characters or personas and actions. And hopefully, if the story is really strong, there is some sense of transformation. But we'll talk a little bit more about that in a second. Research shows that stories have the power to help people edit their personal narratives. We make sense of our world through those personal narratives. And it's important to understand the power that stories have, not only in our lives, but the people that we're trying to influence, the audience, the populations, the communities we work with. In being able to appeal to emotions, we can think about how stories are able to support a sense of empathy. We can actually see that messages that have powerful messages within stories have the power to move people, to reinforce the behavior change. And finally, something that's very important to us as an agency and sort of what we have really specialized in is that it's a way of being able to create cultural connections. Our culture creates a sense of filter for the way that we perceive risk, whether it be about flu vaccination or any other health issue. It creates a filter of how we perceive that risk, and it's embedded in the values that are a part of our culture. So I want to talk a little bit about some case studies, and we had the honor this year of being able to work with the Virginia Department of Health as a way of being able to promote flu vaccination among populations that were under-vaccinated, and a large part of that gap that even widened more so was because of COVID, and people weren't able to access or didn't think it was important to actually get vaccinated for that matter. But we were engaged by the Virginia Department of Health, and we launched what we called the Born Ready campaign that was targeting moms, and pregnant moms specifically, as a way of having them not only get vaccinated against the flu, but also Tdap. And so we were able to create a variety of different strategies and materials and tools as a way of being able to promote flu vaccination for moms. And that included all kinds of digital communications. We had a partnership statewide where we were able to recruit about 350 organizations and trusted messengers to be able to talk to women specifically, because we know that women have a large say in the health decisions in a household. And then we were able to also create videos and had a media buy that was statewide, as well as some media engagement strategies. And they varied quite a bit. Everything from traditional media, we thought it was really important to use radio ads, PSAs, as well as set up radio interviews during particular programs that were very popular. And specifically within the Latino community, we had programs that were very religious in their nature, and we found that we had a lot of followers that tuned in to those particular efforts, not only through streamed experiences, but also live interviews that we did with the listeners of the radio stations. And we would advertise basically the days that we would have clinics in the community that our partners helped organize, or in conjunction with some of the chain pharmacies, and we would drive traffic that way. And one example of how this was such an effective strategy, we had a few clinics that actually I was present at, and the people would line up really early in the morning to be the first to get vaccinated. I thought, how interesting. And then I went up to the folks in the line and I asked, what brought you here? Why are you here today? And every single person that I talked to said, we heard it on the radio. We saw it on Instagram. We saw it on Facebook. So the digital ads were working, one, but it was that radio connection that really made a difference in terms of hearing the comments, the messages, the PSAs coming from the radio personalities that they really like to listen to. And so that was wonderful. We had a lot of people get vaccinated, whether it be at the chain pharmacies, whether it be at the health departments, or some of the community partners that we actually worked with. So that was really exciting. The other thing that we did was that we organized a webinar with some subject matter experts and the health department as a way of being able to address how we wanted to also frame this particular campaign through a health equity lens. And so we had a very serious conversation about the fact that, unfortunately, the mortality rate amongst African-American women, pregnant women, is much higher than any other group. And we wanted to talk about, some of the disparities, and also, more importantly, the root causes of the inequities that do exist. And we also worked with a lot of church groups in the community for Mother's Day. We went out and reminded pregnant women about the importance of getting flu and Tdap vaccines. And we had some wonderful events that our partners organized in the community for Mom's Day, Dia de las Madres, and that was quite good. Now I want to turn it over to someone that I admire greatly and that I consider a partner in our fight to promote flu vaccination, and that's Michelle Call. Michelle Call serves as the National Senior Director of Infectious Disease and Immunization at the American Lung Association, where she is responsible for the development and execution of all national health education programs, services, and activities related to infectious diseases, including including COVID-19. He oversees lung health promotion activities to lessen the impact of infectious diseases. And I met Michelle a few years back at a conference in Connecticut. And I guess she liked what I had to say because she invited me to be a partner in the development of these toolkits. And I now turn the microphone or center stage over to Michelle. Michelle?
Thanks so much, Carlos. Good afternoon, and hello, New Jersey from Connecticut. Thank you so much for having me. The American Lung Association understands the power of storytelling and often engages patient, caregiver, and healthcare provider stories in all areas of lung disease, including influenza. And you may have seen some of our stories when we had our My Shot campaign floating around. They were used by many coalition partners throughout the country. So I'm going to switch gears a little bit to talk about a couple education initiatives here at the Lung Association. And the first I'd like to talk about is the American Lung Association campaign in partnership with the Anthem Foundation. We recently announced the launch of the Fend Off Flu educational campaign. We know that COVID-19 is persisting, and we have relaxed COVID-19 mitigation strategies throughout the country, and influenza may be more severe this season. So we recognize the need for additional educational tools. I'm going to wave my arm because my light just shut off. The Fend Off Flu campaign aims to increase flu knowledge and encourage individuals to get their flu shot through a three-pronged approach. So the first prong of the approach is providing flu educational materials to workplaces, looking to educate their workforce about influenza and the importance of vaccination. And you can see on this slide is the cover of the toolkit. The second prong is supporting efforts to educate patients through healthcare providers. As we know, healthcare providers are one of the most trusted messengers of flu information and have a real impact on whether or not a patient will get their flu vaccine. And then the third prong is protecting older adults at high risk for influenza complications by encouraging flu shots in caregivers and close contacts. So you can find our materials on lung.org/fend-off-flu. And I know that will be provided after the webinar today. So that's the web link. And that site will be updated throughout the flu season to incorporate additional educational materials. But if you visit our website now, you can download the Workplace Toolkit to promote flu vaccination throughout your workforce, or if you have partners who might want to download it and promote it through their workforce. You can also participate in our recorded webinar entitled The Critical Role Healthcare Providers Play in Fending Off Influenza, and that featured LJ Tan of the Immunization Action Coalition, who discussed the past flu season, upcoming flu season, and ways to talk to patients about getting their flu shot. And also Dr. Victor Waters, CMO at Dignity Health. He's also on the national board advisor for Black Doctors USA. And he was discussing disparities in influenza vaccination. So if you wanted to listen to that, it's on our site. And you can also share the 5 easy actions to stay healthy this flu season animation with your family, friends, community, workplace, however you'd like to use it, but it's a tool for you. The second initiative that I just wanted to touch on real quick is our COVID-19 vaccination tools. So because we know the COVID-19 virus and the flu virus will be co-circulating this season, I thought it was important to bring these up. The American Lung Association worked with partnering organizations, including HMA, Carlos, to develop the Better For It Toolkit series. And this series really focuses on communities of color whom we know have been disproportionately affected throughout the pandemic. And we just heard some statistics about flu. It's not really different for COVID, except that some of it has been brought out even more. So We worked with these partnering organizations to develop culturally competent factual guides for vaccine ambassadors and trusted messengers to deliver science-based information within their communities. So these toolkits address how to begin conversations on how to make a well-informed decision about COVID-19 vaccination in a non-persuasive way. And they also include FAQ sections with linguistically and culturally appropriate responses. So one thing we all say in the flu field, right, is when we've seen one flu season, we've seen one flu season, but we know that continued work to educate about COVID-19 in combination with flu will definitely be a challenge this season. So I wanted to take an opportunity to thank you for all the work you've done thus far and will continue to do throughout the flu season. We here at the American Lung Association hope that these tools will be of benefit to you, and thank you for hearing me today.
Thank you, Michelle, and to the entire ALA team for all the amazing work that you've been doing nationally. And it's been an honor really to support your project. I want to move on and talk a little bit about the flu campaign materials that we developed for the CDC. We worked with them quite closely for many years, and I want to highlight one particular piece that I thought really demonstrates the importance of being culturally sensitive, culturally responsive to particular communities. And in the case of promoting flu vaccination for the CDC with Un Amor Perdido, this initially was created as a radionovela. For those of you who don't know, telenovelas, which are soap operas, are very, very popular with Latino cultures. And that is no different even if they have to listen to them through podcasts or radio, and in some cases, and we'll demonstrate in a little bit, animated graphics. So we developed this radio series that was a 5-part series that was based on our true story. And the research that we showed that we actually had more people really remember the stories when it was about someone that was real and someone that they could relate to. And for Latino community, we developed this series, and it was about a pregnant woman who didn't follow her doctor's advice. And she got very, very sick with the flu, and she ended up dying, and she lost her baby. And her husband, Eduardo, then made a commitment to becoming a vaccination champion in LA as a way of being able to tell other Latinos it's so important for you to protect your family with vaccinations. And we asked him if we could share his story and turn it into this radio novela series, and he agreed. And one of the interesting things that we did with this particular series is that we were able to partner with a variety of different radio stations. And one in particular was called Radio Campesina, and it was a station that was actually founded by Cesar Chavez in Salinas, California. And they have a network throughout Arizona and Washington and California. And we were able to get some radio interviews with a doctor as a way of being able to address any questions from the farm workers. And we would actually go into the fields and watch what was happening. And what we learned is that the foremen of the fields would actually blast out a radio station music as a way of being able to sort of forget the hard work that they were doing by time, and the time would go so much faster when they would listen to music they really liked. And I don't know how many of you have ever been out on a farm or seen how seasonal farm workers work, but they're stooped down in the field all day, and they wear these giant black rubber boots because the lettuce fields are wet and they need to be protected. And so being stooped all day that way is hard work. It's really kind of work that a lot of people wouldn't do. But we would interrupt their music program with the radio novela, and then they would be allowed to call in the host of the radio program with questions with the doctor. We got so many questions from people calling from the field. It was a very moving experience because they really wanted to get information. Well, then we would organize clinics that would actually go out into the fields and be able to protect the workers against the flu. And it was a success, but it was a very moving experience of seeing that. So then we were told that they wanted to actually see a graphic novel. So we created a graphic novel, Un Amor Perdido, and it worked quite well for us. And that bear that you see in the image became a part of the symbolism that we used for the campaign. The bear was something that kids could really relate to. And we used that bear for a coloring contest that kids could actually participate in. And we had a panel of celebrity judges to be the judges for the coloring contest that we actually launched in LA. And we went to a hospital in LA as a way of being able to launch the campaign from there. And we had the winners of the contest, and the little girl who won went to a parochial school, private school in LA, and they were so cute. They showed up to the press conference and they were wearing their little uniforms, and the cameras were going crazy, and she was taking it all in. She knew how to work that camera. She was constantly posing. And then I went to give her her gift, her prize for winning, and it was a gift card. And when I gave it to her, she just looked at me and said, "Thank you, but you're in my light." So I just laughed and said, "Okay, excuse me, pardon me," and I walked away, and it was all her stage. But it was a great event to do that kind of work with young children, and it was just very heartwarming. So then we turned this into a graphic novel, an animated graphic novel for the CDC. It was the first chance that the CDC had to do this, and they took a risk with us. They didn't know how it was going to come over, but it turned out to be a very effective way of being able to get this particular piece into the hands of the community health workers who told us, we're tired of carrying paper. We want something that we can show on our phones, that we can show on our tablets, and that we can educate people one-on-one. And it worked very, very well for them. So we're very excited about the fact that this particular campaign had this piece that we were able to repurpose as a vehicle of being able to get people to respond, to think about the fact that they needed to get an annual flu vaccination, and it worked very, very well for us. And it was something that was culturally responsive and based on a true story of a woman who unfortunately lost her own life and that of her baby. The take-home message is pretty clear, that stories can appeal to audiences emotionally, stories are resonant and memorable, and stories can reinforce behavior change, and that they can create community connections. The pieces that we worked with Michelle, there are stories that are integrated into the toolkit. Some of them are about the doctors that made a big difference in their influence in being able to develop the vaccine. So stories can be integrated anywhere, whether it be a piece of song, whether it be something that's traditional in terms of a graphic novel, or even short little tweets could really generate stories. So they can work, they can be replicated, and they can create change. And with that, I'm going to stop there and let's have that Q&A session. And so, Amy, can you help us with this?
I sure can. Michelle, do you want to come back on? Hello.
Hello.
That was terrific. Thank you so much. I just want to remind everybody to please put your questions in the answer box, and I'd be happy to pose them to Carlos and Michelle. So the first question is, 2020 was a unique year. Can someone address how the 2020 flu vaccination rates differ from other more typical years?
Yeah, so I'm happy to take that. So we're talking about last year versus typical years, correct? So last year we saw record, are we talking about vaccination rates? Sorry.
Yes.
Oh, so we did see some increased vaccination rates, but that data is not available yet, and I believe it should be available any day now. So I can't speak directly about what those vaccination rates until we see them from the CDC. Preliminarily, we have heard that there were some increases in flu vaccination rates last flu season.
Thank you. What made the campaign Born Ready unique?
That's an interesting question. There was some uniqueness about the Born Ready campaign on a couple of levels. One, the state wanted us to focus in on three particular groups where there were gaps: African American or Black populations, Latinos, and American Indians. And oftentimes, we don't always remember about our American Indian friends. And so that, I think, in many ways was unique. And what I did not know when we first started the campaign is that the state had tried for many, many years to be able to engage the American Indian tribes that are in Virginia. Now, there is an interesting history with the tribes there. They were never officially recognized until 3 years ago. And I want you to realize that these are the tribes that met the first Europeans to land on the continent, in the Americas. And yet they weren't recognized until 3 years ago. And so there is a high level of distrust. And our job was to go in and try to not only develop campaign materials that reflected the populations of the tribes, but also were influenced and completely driven by the tribe. So the first thing that we needed to do was make that connection. And it wasn't easy, but it was a question of being able to build trust, and little by little, we did that. And when the state asked us, how did you do it? I said, we just showed up and listened. We did very little talking. It's so important, and you all know that listening to your audience is critical, but honoring the history, the tradition is even more critical in this case. The other thing that made this particular campaign unique is that we used a song, we used a lullaby as a way of being able to tell a story about the importance of flu vaccination. And it was about being born ready. I'm going to share it with you really fast, if you don't mind. I'm going to see if my equipment works, hopefully. And Amy, just nod your head if you can hear this.
You were born ready, ready to fly. Yes, you were born ready, my sweetie pie, born ready to fly.
And I'm just going to stop there, but it tells a story of a mom being so loving to her child, so loving that it was important for her to get vaccinated and to protect her baby that way too. That made it unique.
I love that. That's really, really terrific. We do have some specific questions about the toolkit. And I think they're talking about the Power to Protect toolkit as opposed to the one that Michelle discussed. So last year we posted the toolkit as a PDF on the New Jersey Department of Health Flu website. So there was a request to do that again this year, and we will follow up with that. We do certainly have the toolkit available for folks through the Power to Protect NJ website, and our next presenter will talk more about that. And then there was a question about the new flu vaccine finder. Last year we used the vaccine finder tool, but now that's just for COVID vaccination. So the question is the 211 the new flu vaccine finder?
I'm happy to give, I'm happy to give a little bit of information. So I'll let you know from, because I was on a CDC call recently, that they really quickly launched the flu vaccine finder portion of the vaccines.gov database, but recognized there were some bugs in the system, so they had to take it back down. So last week, they said they needed a couple more weeks before they relaunched. Good thing it was a quiet launch. Before they relaunched the flu vaccines. They are not going to be uploading other adult vaccinations at this point. It'll just be COVID and flu shots. So that's what I know, and I'm glad I could answer that.
Yeah, thank you, because I thought I was going to have to come up with something.
No.
This one's also for Michelle. Michelle, what other materials are planned for the Fend Off Flu campaign?
Yeah, so there's a lot of materials still planned for this flu season. So coming soon, some of our materials will be available in Spanish. We'll be having some storyteller videos on our website. An additional toolkit and webinar will be on the horizon as well. So stay tuned, bookmark that page and keep coming back. And also, Amy has my contact information, so if anybody's looking for me, I'm sure she'd be happy to connect.
Absolutely. Thank you. Thank you for being open to us sharing your information.
Absolutely.
So Carlos, what would you say are lessons learned for engaging underserved communities?
I'm going to address that question, but before I go there, I want to also share that part of the toolkit that is being developed right now from Michelle includes a package that will be specifically for caregivers of older adults. And I have to, because she's so humble about this, but one of the tools that she has that's really quite effective and really uses the power of trusted messengers are some videos from trusted messengers that they engage throughout the country, including an American Indian trusted messenger that was really powerful. So the ALA gets it, and they're doing great work, and they have some videos and testimonials from trusted messengers. So check those out too, they're great. Lessons learned. You know, I had mentioned one earlier, how important it is to listen, and to listen with an open mind and with an open heart, because really you may hear things that you do not want to hear. And unfortunately, there's a lot of misinformation out there about vaccines, and the misinformation has tripled, I would say, in relation to even COVID. And so it's important to learn how to navigate around that misinformation, that disinformation, and being able to learn how to work around it as a way of focusing in on the possible, the positive, instead of getting sucked into the politics of it. And so I think it's really important to have that lens on, because otherwise you might get sucked into it and really feel discouraged, and you can't let that happen. You can't give up your power, because you're all champions, and that means that you know what works best. I would say listen carefully, and don't get discouraged even when things look bad.
Yeah, and I would add too, to ask open-ended questions. You know, one of the things that happens is, I think it's inherently human, right? We make assumptions, but you don't know the right information until you ask the right question. So part of the reason you see a lot of implicit bias is because people make assumptions, right? Instead of asking those open-ended questions. And that could really help with addressing some of the barriers.
Thank you. Do either of you have any last words that you'd like to impart to our group today?
Michelle, do you want to start?
Well, I mean, this is no surprise to any of you, but I encourage everybody to get their flu shots, and also to talk to their family, friends, co-workers, communities about getting their flu shots. And I will be getting mine today. So thank you guys all for letting me be here and for all the great work you're doing. I know that this is a field that sometimes requires a lot of passion, because it can be frustrating, but it's people like you that I love to work with, because we're all passionate and we're getting the shots in the arms that we need to do.
Thank you very much, Michelle, and thank you for joining us. Carlos?
Yeah, I'll say that we could never feel like we have this work to be done alone. We're not alone. We have each other. We have groups at the national level. We have groups within our own neighborhoods. But most of all, you have your own family. And when you feel sometimes discouraged and a little down, because it's been a tough 2 years, just turn to the people that are around us immediately, who love us and can support the work we do. And I'll end with that.
Thank you so much, Carlos. Thank you, Michelle, for joining us. We really enjoyed your presentation, and it was wonderful to hear about your very unique and exciting initiatives.
Thank you.
Bye. I'd like to now turn the meeting over to Monica Smith. Oh, there she is. Hi, Monica.
Hi.
Monica is the Partnership's Chief Development and Communications Officer, and she has some exciting news.
Well, thank you, Amy. It's really a pleasure to be here again with the flu campaign. It was such a success last year, and it was really because of everybody on this call. I'm going to just start my slideshow here, and hopefully everybody can see it. When we talk about the Power to Protect campaign, I think the strength of it was really in the organizations that banded together to really get the message out in New Jersey. And, we had groups from Sussex all the way down to Cape May participating in this campaign, and this is why we're so excited to have it again. I just want to talk about some of the little updates that we have for the toolkit and some of the new resources that we have. So we have updated our toolkit, and we have a wonderful letter from Commissioner Persicelli to lead off the toolkit, just talking about how happy she is that everybody is joining again this year to make the flu vaccine a priority. I think if we've learned anything from the COVID-19 pandemic, it's, vaccines are critical to public health, and there's a lot of misinformation. So one of the pieces that we're really focusing on is this idea of, can you get the flu vaccine and the COVID vaccine at the same time? Do you have to wait? And Amy has just recently started a new video with Dr. Beanstalk. He's a pediatrician in northern New Jersey, and they actually address this issue and the vaccine for children. So that's an exciting new piece that we have. We also have some new social media images. Our marketing company is working very tirelessly right now to get the new images updated on the website, so it should be fully complete this week. But we've added some images in addition to the ones that we had last year in multiple languages as well, and of course the website can be accessed in multiple languages. We're also going to have some new posters. One of the things that we heard from everybody who participated in the campaign last year was they really wanted something to go to promote their own flu events. So there will be a fillable poster where you can put information about your flu clinic, your flu fair, put the date and the time and the location, and then just email that out or post that on whatever social media channel you have. We also will have free pre-printed posters. So if you're having big events and you would really like a stack of posters to have out directing people to the website, you can contact Amy, and we're going to have those available as well. Of course, we're going to continue to have the periodic meetings. When we looked at last year's campaign, one of the biggest piece of feedback we had was that people really liked the meetings, whether they watched in person or on video. But in addition, when we send out our email messages, we'll incorporate some resources and maybe some of those 15-minute conversations that Amy may have with an expert, so that you can get kind of your information in chunks. We know that everybody's kind of overloaded with some of the Zoom calls and the meetings. And of course, with the email updates, we really want to hear from you. What are you doing for the flu in your community? And I'm going to talk about that again in a minute. And of course, please put your Action Group member badge on your website, on your social media, and let people know that you are a proud member of this coalition of nonprofit organizations, hospitals, schools, universities, childcare centers, that we're all united in one great cause. So just a little bit about Power to Protect NJ for people who need a refresher or may be new. You can download all of the social media graphics right on the website. So again, we're adding those new pieces in. You'll find them in for Twitter, LinkedIn, sized for Facebook already. We also have the banner, so you can add that to your homepage as well. We have updated the flu vaccine finder until it's ready to go. The nice folks at NJ211 have a great resource where they really list all those health departments so somebody can find a vaccine near them. And of course, again, it translates to multiple languages. This is just what I mentioned about our videos. There's 4 up here, but there's about 8 videos in total. Most of these are very short, but we will be adding these longer videos that really go a little more in depth with some flu questions, especially around COVID. And, so your job as members is we really want to reach our communities. And we know in New Jersey, You know, our territory is very distinct. What works in Hudson County may not work in Warren County or work in Cumberland County. So, you know, what are you doing in your community to reach the people that you serve? We ask that you post weekly or bi-weekly on your social media. You can use our social media shareables or get creative. The Kaplan JCC last year did a great campaign where they had their staff holding up signs that said they got a flu shot. That really ties into that idea of somebody can relate to the organization and the people who work there and say, oh, okay, well, if it was okay with them, maybe it's okay for me to get a flu shot. You know, link to our Power to Protect website. Here at the partnership, a lot of our staff are putting Power to Protect NJ signatures on our emails so that every time somebody sees it, they may click and find out more information about the flu vaccine. Share an article on your website or in your e-newsletter. Go live on Instagram. We'll be doing that again. The Power to Protect social media is ramping up, so we will, you know, post often. Karen Amadeo, who is actually running this webinar, is our communications manager, and she's going to be on the lookout for any tags that you put with the Power to Protect hashtag, Fight the Flu NJ, so she can share and she can promote what you're doing as well. And then just, you know, your community events, please use the form on the website to send in what you're doing. These are events from this year already. So we're gonna post those, we're gonna help promote those as well, but it's a nice resource that we can all share with one another. So action steps, what do you need to do? You know, we really designed this campaign so it's unbranded to the partnership. We want you to be able to take these materials and put them out just for the health of New Jersey. So please review the toolkit in the website. If you have a communications person at your organization, please work with them. You know, we do a lot of communications here, and if somebody comes to me and says, this is all set and ready to go, it makes my life very easy that I can just plop in the calendar when we're gonna promote the flu and the flu vaccine. You know, again, place your badge proudly on your website, plan your posts, plan your events, use our hashtags, and please, please, please send us your photos. If you're doing an event in the community, send us photos of what you did. If you have something unique going on within your organization, let us know about that, because we really want to amplify that message. If you've created something that you think is really cool, that's your own branded piece for the flu, please share that as well. We really want this to be a community of organizations working together to promote the flu vaccine, which we know is just critically important. So I am just gonna pop up Amy's information on here, NJ Flu Action at partnershipmch.org. Please go to our websites. We're gonna continually send some of this information to you and let you know all of the latest updates. And I am gonna take a break. And Amy, I don't know if you have any questions or you want me to fill anybody in on other promotions that we have.
This is great. You've actually covered most of what I was going to say at the end, but I had a couple of more things to add for everybody's to-do list. One is make sure you check out those newsletters that will be coming to you monthly from me. They will have resources, events, all kinds of information. For those of you who have flyers listing your events, if you send them to me, I can help get that word out there. On the webinar today, we actually posted the flyers from the Ocean and Union Counties events, but we'd love to promote other people's events as well. Please, we encourage you to extend invitations to colleagues who might be interested in joining us, if they can use our resources, and we'd love to have more input from people all over the state. And finally, I do want to mention that the New Jersey Department of Health has some additional resources on their website, and they also have information about two very interesting other initiatives besides ours, the College and University Flu Challenge, and also the Influenza Honor Roll. So please check out the New Jersey Department of Health website for those initiatives. So now I just want to thank once again our wonderful speakers. You guys were great. I'd like to thank Karen Amadeo for providing our tech support. and to all of you for joining us today. Be on the lookout for a follow-up email, which will contain links to some resources from our speakers, as well as a brief survey to give us feedback. With your support, we have the power to protect New Jersey. Thank you.